Medicaid expansion has served as one of the key political issues in North Carolina politics. Governor Roy Cooper and legislative Democrats favor expansion. Republican legislative leaders oppose it. A recent study from the Foundation for Government Accountability, or FGA, adds more evidence to the debate. Joining us now to discuss that study is Roy Lenardson. He is Government Affairs Director at FGA. Thanks for joining us.
Well, it's good to be here. Thank you for having me. And I should add, Jordan Roberts, right here at your organization, John Locke, was also the co-author of our latest study. So we actually teamed up with you guys right here in North Carolina. FGA is based out of Florida. We work in over 30 states, 501c3, but we partner with groups, particularly groups like you guys, which we value the input. So it's actually co-branded.
Aha. Well, the Medicaid study, obviously, this is something that's been a part of our politics,
That's right.
A key issue. And now your study is saying that, at least in terms of how it affects hospitals, Medicaid expansion is not all it's cracked up to be.
Yeah, here's what's interesting. As the data starts to roll in here, we're 4 or 5 years into this. It's one piece of bad news after another for the folks that have expanded Medicaid. So if you look at it, it's almost like the four horsemen of the apocalypse here when it comes to Medicaid expansion. One is the enrollments are more than 100% off in the states that expanded it. So if you said you were going to have 100 people, you ended up having 200 people in your states. And unfortunately, when it's more like they said 200,000, they ended up having 400,000. And so every single solitary state that has expanded Medicaid has been off by a factor of more than 100% for the most part, some even much larger than that. So the enrollment numbers are wrong. So that's sort of the horse number one.
And when the enrollment numbers are wrong, it's not just there are more people, but it's
the
more
second
costly.
horse. It bankrupts budgets. What we like to say is it almost Pac-Mans your budget. So think of things that you care about here in North Carolina. Your roads, your great university education, your top-notch K through 12 education, bridges, public safety, taking care of your environment, your beaches, the mountains. North Carolina has it all. Where do you think the money comes from to pay for Medicaid? It literally eats the other pieces of the budget. So, we've seen in some states where the Medicaid budget now consumes almost 35% of the state budget. And so more than, typically a state budget will be about 20% education. That's what's happened. It used to be 20% Medicaid, then higher education. That's reversed. So it's literally eating your budget alive. And there's nothing you could do because once you expand Medicaid, you're beholden to the federal government. So you've got the enrollment explosion. You've got the cost explosion. The other absolutely dreadful thing this does that folks don't realize is that if you earn between 100 and 138% of poverty, okay, $16,000, $17,000 a year, you are eligible to be on the Obamacare exchange, which is a totally different federal program, for free, or maybe $10 a month, depending on your income, but very minimal. That is private insurance. Okay, so if you're right now in North Carolina, if you're between 100 and 138% of poverty, you're not on Medicaid, you're on private health care for $10 a month. If you pass Medicaid expansion in North Carolina, those people, and there are tens of thousands of them here in their state, are no longer eligible for the private insurance program. They are forced onto the welfare program. So people need to understand that. You are literally condemning tens of thousands of North Carolinians who right now have insurance in the private sector, paid for by the federal government with a small subsidy. It's against the law. You can't be on it. You are kicked off immediately and transferred to a Medicaid program, which is inferior insurance, okay? It's medical welfare. The other one is private insurance. So that's the third thing. You kick off people and condemn them to a life of welfare. And you know what the only requirement is? Stay poor. And that does not seem to be the kind of message that you want to be sending. The other issue here is, what does this do to your economy? You have over 250,000 open jobs right now in North Carolina. More than 40% of those open jobs provide insurance. You don't need able-bodied adults to stay poor and stay home. You need able-bodied adults to get off the couch and go to work. Medicaid expansion has the exact opposite effect of that.
Got bad incentives there. Bad incentives.
It removes the incentive to go to work. So it's really dreadful. And so to get to the newest information and Jordan and Nick's report on hospitals, I think one of the things y'all have been hearing is that this will save hospitals, particularly rural hospitals. That is a bald-faced lie. I would encourage folks to go to your website or the FGA.org and read this report. It is not a silver bullet for hospitals. Rural hospitals are continuing to close at an even greater clip in the expansion states. And not to get too wonky, but here's the problem. When you put people on Medicaid and they walk through the front door of your hospital, they're paying between 60 and 75 cents on the dollar of the cost. So every single person on Medicaid that walks through the door, that hospital loses money on that person. That's not a success model. And what happened is, I told you earlier, remember I told you all those people who got kicked off of private insurance and onto Medicaid? Well, people may not know this, but the private insurance folks, they're paying 150 to 250% of the costs. Okay, so they're subsidizing the other group. Well, when you get rid of all these people who are private pay and put them on public pay, it's a double whammy, right? You're losing all that money. And then the other thing that happens is the usage skyrockets. So hospitals are then become inundated and can't afford to do business, and they're losing money. I mean, Colorado, you should look at the reports. Vermont, it doesn't matter the state. If you expanded Medicaid, your rural hospitals are closing and you're losing money. That's the key takeaway. And I think that's one of the most frustrating things, because hospitals are important to communities. I would argue that hospitals are actually not. The building is not important. It's the doctor, the nurse practitioner, the physician assistant, the nurses, the CNAs, all the folks that provide direct care are important. And so maybe rural areas are going to have to think about, are we in a big brick building, or are we sort of doing it the old way that we did it, in a small facility or a smaller clinic? So I think there's a way to provide health care. The Medicaid debate is not the one to have. It's not going to help.
Some people who've been following this debate will say, well, there's some pros and some cons of Medicaid expansion. If they listen to what you're saying, they're going to say, wait a minute, it sounds like it's all con, no pro.
Listen, these people are poverty peddlers. Don't forget that. They need people on welfare to establish their value. It's not about the value of the human being, the dignity of going to work and having a job and earning a paycheck and supporting your family. Their value outcome is, how many more people can we put on welfare or food stamps, right? The American dream is built on work. There's no other way to spend it. It is not built on a government handout. Ask yourself and the folks listening a very simple question. What would you be more proud of? Your first welfare check or your first paycheck? That's the question for folks in North Carolina need to answer. Do you want to condemn someone to a life of dependency, or do you want to put someone on the path to the American dream? The American dream is built one paycheck at a time, not one welfare check at a time.